EMS is mandated to deliver emergency medical services to the citizens of the Western Cape. Our primary function is to get the right people to the right patient at the right time. Efficiency is a big part of our business.
You work with people's lives, somebody's mother, somebody's father, brother, sister, child even, and if you make a mistake here, somebody can lose their life.
Nationally, the Department of Health sets a target of 90% of our emergency calls we must arrive there within 15 minutes.
Time is the difference between life and death.
The quicker the response, the quicker you get to the patient, the more effective your treatment is going to be. We've got the golden hour, and you need to respond and treat that patient within that hour. It saves lives.
We are made of a communications department. We have ambulance services, operations. We also have health net transport, which is the non-emergency transport services. We have rescue services, which covers the sea, land, and the mountains. And then we also have an aeromedical service. I have 2,000 staff in this organization, 130,000 square kilometers, 500,000 incidents, and 400 vehicles. People ultimately call EMS for an ambulance, but in executing that there are a number of issues. We have 11 official languages, so ascertaining the address from a client at a time, which is incredibly traumatic, can be quite difficult, quite inaccurate. Then you couple that with the fact that many of the informal settlements don't have street names. The nomenclature of the houses or the shacks are inconsistent. So there's a lot of time wasted in trying to search for the location of the incident. One of the things that we cannot afford is we cannot afford that one call to go missing. We cannot afford that one piece of vital information to not get through. So what we needed is a technology solution that is reliable, consistent. What we didn't know was what technology solution would best match that demand. So that was where Dimension Data came in. Ultimately, what they brought more than anything else is a willingness to engage with the client, a willingness to hear and listen and advise. What the solution was really envisaged to do is to take every process involved in the rendering of emergency care and looking at ways in which technology makes that easier, more efficient, more reliable. This is like delivering on an aircraft build whilst it's in the air. So when we started the receipt of a call, we had to look at how we capture calls, how we determine location, how we transfer that information to the ambulances.
The MDT system navigates you through the GPS system and takes you directly to the spot where the patient is. It doesn't matter what area it is. It's bang on the coordinates.
We also needed to find a way in which to capture electronic records.
As soon as you're sitting in the ambulance with your patient and you're completing it electronically, it goes directly to the hospital. The hospital knows exactly what patient you're going to come through with. And that's where they can advance the treatment and prepare themselves better for what calls coming in.
We also needed to know more about what are the other processes that drive the business, like the staffing profile, the training, the consumable usage, and the use of equipment. We needed a business intelligence model that was able to give us the analysis and the data that we would need to better respond to those needs and so gain far greater efficiencies. All of these solutions are what Dimension Data have undertaken to deliver to us as the client.
This system is so simplified. It's a press of a button. Nothing major rocket science that you need to understand. Be computer literate for it. With the MDT system, it's a yes or no. You press a button and you're there.
It's the most ambitious and technology advanced solution in EMS. And to do that as Africans for the population, I think is awesome. We always thought that whatever we do here, we'd have to replicate in other provinces, in other countries. But actually, what it now means is that there's no need to transplant. We could deploy a solution into the cloud that benefits anyone, anywhere. I'm pleased to say that the solution is not my idea. The solution is not what I imagined. It's far better than that. And the reason it's better is because other parts of my organization and Dimension Data's organization have really owned the challenge.